Kenya AIDS NGO Consortium has hosted a delegation of parliamentarians from the United Kingdom in collaboration with Results UK.
My name is Professor Alan Raggi. I'm the Executive Director for Kenya AIDS NGO Consortium, commonly known as KANCO. For us to be able to influence what must be done and why, we needed to have both government as well as that work together. The elected leaders play a major role in giving the direction in the best way possible. What we have done with the UK members of parliament now is to allow them to mingle, so to say, with the Kenyan communities, visit institutions, so that they can be able to experience what is being done, what are the issues.
My name's Vinny. I work for an organisation called ResultsUK, working on international development and global health advocacy. Kenya has made real positive strides in global health, and we wanted our parliamentarians to see that firsthand, because we very much believe at Results that it's much more powerful to see these things firsthand instead of hear them or see them on the media. It's much easier, and you can tell a much more convincing story in Parliament and to your constituents when you've actually been and seen the clinics, seen the people living in poverty, seen the children who are growing up in those areas.
The delegation has visited health facilities including Rhodes Chest Clinic, Ongaterongai Sub-County Hospital and Kibera Health Center to evaluate the advancements made in the healthcare system in Kenya, including tuberculosis, immunization and nutrition.
Over a period of years, we know that technology and experiences have spanned across, and we have done a lot of good work. Looking at those days of HIV, AIDS 101, and finally those days where we were looking at issues of TB and malaria, nutrition.
Through collaborative efforts of governmental and non-governmental organizations, including civil society organizations, Kenya has made significant strides in the fight against tuberculosis.
I'm a TB champion. Representing young people from the network of TB champions. I am so passionate when it comes to fighting TB because I have been affected with TB, and for me it was not a walk in the park to fight with it. Actually, I had self-stigma in the first place, then plus my friends now also stigmatized me. So when I saw it was curable, I felt like I need to come out and talk about it, and even try and talk about it to my community members. That includes the young people.
The Kenya TB program is one that prides itself as being very collaborative in terms of its engagement processes. And when we look at collaboration, we're talking civil society, we're talking communities affected by TB, and even at the lower levels, at the very community level, working closely with the patients themselves to make sure that treatment is actually people-centered.
Interventions have also been made in the health sector in the fight against malnutrition, especially among children.
Watoto walikuwa hali mbaya sana.
That time the children were not doing well.
Lakini leo,
but today,
watoto naona nafurahia. Nakumbuka mali
he sees his children, he is happy because he has seen that he has gained knowledge and he has now a testimony.
My name is Camilla Consamangi. I'm Results UK's Parliamentary Advocacy Officer for Child Health. Children have the future. If they're malnourished, if they're weak, if they're not growing properly, and when it's fatal, it impacts society a lot. It means loss in economy, loss of ability to work, loss of ability to learn.
Healthcare workers, including community health volunteers, have been a key pillar in providing quality and accessible healthcare in Kenya.
Community health volunteers, as community health volunteers, she's so grateful.
Kwa maana hiyo imetusaidia sana kufanya kazi na kujishisha. So training imetupatia.
Yeah, with the trainings it has been easy for them to work at community level.
Na tunashukuru maana tumepata skills, tumepata knowledge ya vile tunaweza kufanya kwa community.
Yeah, they've received great skills and knowledge on how to work at the community level.
Although Kenya has achieved significant milestones in the health sector, there are still some existing gaps in the healthcare system.
So one of the things that I noticed across the board was the fact that lots of things are actually still handwritten. So digitalization, or the lack thereof, is one of the biggest cause for concerns because of the amount of man hours it takes to actually check records, write records, and all those things. Another thing I would say is lack of capacity. So we see that the services are great and the people working are there every day fighting the fight, but there's not enough beds, there's not enough x-ray machines, there's just not enough facilities and staff. So that's definitely one of the things that we'll take back home.
We need to do more to find the missing cases, which is quite a big issue in the Kenyan context. So that requires, really robust contact tracing. It requires really good engagement with community health promoters and also other community leaders. I think really what Kenya needs, and actually it's not necessarily a problem that Kenya can solve on its own. We just need better medicines for TB. We need a vaccine for TB, and we need to be able to distribute them really easily and efficiently.
Through collaborative global interventions and funding, Kenya is able to fill the existing gaps in the healthcare system.
Other than just pushing for or advocating for money at a global level, we realize that when we have the stories from the ground told at the decision-making tables, we have an impact.
Very often you'll see a sign to say that this has been done with help of investment from the US, from the UK, and I think it's appropriate that that sort of thing happens and that we feel a responsibility through the Commonwealth to help countries who haven't got the same sort of income that we have.
In less developed countries, they receive less from tax, for example. So international funding really helps fill in the gaps where the domestic resource mobilization can't do it by itself. So it's just very important that not only we continue sending money to Kenya, but that it's increased where it needs to be.
An improved health sector has been cited as crucial to the development of less developed countries, including Kenya.
I'm Maggie Throop, a Member of Parliament in the UK government. I think it's really important that the children are captured very early on and vaccinated, and we do that in the UK. But I think it's the way you've been educating the mothers and families as a whole as to the importance of vaccines and immunisation, and how you've got the community leaders going out and the people who are trusting the community. You see the impact if people aren't vaccinated. Communicable diseases, the infectious diseases are still quite prominent in many parts of the world, not just in Kenya, and it's the easiest way to help people to keep well. I say that after clean water, immunisation is the most impactful preventive measure that you can put in place. So the more people are vaccinated for any disease, the better.
Tuberculosis is humanity's oldest disease. It's been around almost as long as humans have been. And yet in that entire time we haven't come up with a good vaccine, a good treatment which has effectively eradicated the disease. Tuberculosis is a disease of poverty. No one is safe from it. It's able to get anywhere in the world. So just because we in the UK don't live in a particularly high prevalent country, it doesn't mean that TB can't effectively come for us, especially with new strains of multi-drug resistant TB, which are strains of TB which are immune to modern medicines. So it's important to solve TB by 2030 because at the moment 1.6 million people die a year of TB. And they don't have to die. Those are effectively needless deaths. But the reason those people die is because the international community isn't doing enough to raise money, to raise awareness, and to get the medicines that we do have out to the areas in which they're needed. So what we need to do as international partners is we need to speak to the drug companies, we need to speak to other TB stakeholders to find ways to increase the supply of drugs and increase the supply of TB expertise and other things into Kenya so that they can sufficiently tackle their TB burden.